A lot of people really want to get this, one and done, and I cannot blame them. Some doctors can do pretty good mecha sessions with a great success. I mean, they've proven themselves that they can do 6, 7, 8, 10, 9,000 grafts in like over one surgery. I'm not saying that's the best or gold standard. Definitely not. I'm a huge proponent of multi-step approach. Less is more, because you never know. Something gonna happen. You might have some underlying scalp condition that you didn't know about it. Your surgeon didn't check. Nothing grew. And then what? You've done 6,000, 7,000 grafts, FE, all gone.
This podcast is brought to you by Mane and Steel, hair for life. Welcome to the Mane and Steel podcast. Discussions on hair loss, men's health, style, confidence, and everything in between. Thanks, for coming on. I've been following you for years, I think. And if anyone doesn't follow you, they should follow you. And I'd say go back to all of your videos and start from the beginning, because the information and the education is so good compared to what you get online just reading stuff, but visually seeing things. It's awesome. And you and I quickly chatted on this, how things are changing for topics. It's hard to just talk about medication anymore or hair transplants. People want a little bit more edge to hair loss to give them hope. So like celebrities and stuff. So I guess we'll hit on that a little bit today. But yeah, thanks for joining. And as we go along, we'll try to stream some photos and stuff, what we're talking about in the links, descriptions. Mr. Rolandas will put all your stuff in there. Please, guys, go follow his channel. It's really, really, really good. You're one of the top, I would say, who I've been following for a long time.
Thank you. Yeah, that is, I wouldn't say go and watch all the videos. You're gonna take them, days, if not weeks, because I've got like over 200 videos, probably like 250 or something. I lost even count. But yeah, I've documented my whole journeys, my 3 transplants. From the beginning, I was an 5A, so it's a lot of. I've covered a lot of topics essentially from A to Z. Whatever you think about hair transplant, it's probably all there. I've been the most transparent one when it comes to, documenting it with all the light conditions, with all the angles, with all the wet, dry, all kinds of, hair lengths. I've experimented with super short, with super long, like whatever you think, it's there. So that's that. Chris, thanks for inviting. It's a pleasure and honor. Like I mentioned earlier, I dig your, the studio. Looks really, really cool, really professional.
Well, you're officially my first podcast that I've done for the company and stuff. And you just touched upon like hairstyles and stuff. Your hairline's perfect. And touching on how you look visually, and that's a big thing. We'll get into that topic later on camera, is even looking at the scars when you buzz down your head, which was incredible to see that, how just going to even just a grade 2 with FUE and with FUT, just covering a little bit, you don't see anything with a good surgery. And your hairline, because you've had 3 now, correct?
Yeah.
Is mature. It's natural, right? You can't tell, and I've still got work to do. I'm doing another one, but you can't tell that there's a big dramatic procedure that's been done. Right? Because these are big procedures. I still can't believe how good your donor looks compared to when you buzz it down. It's crazy. Yeah, I mean, it just goes to show.
It's pretty short right now.
No one would know. I remember you posting the subway photos or wherever you're on the bus and looking down and stuff and seeing the top of your head and stuff. But yeah, just looking now what you have it's incredible. It really is a testament to good surgery. Right?
Yeah, well, definitely. I mean, to be fair, when it comes to my scarring, my scars are much more visible than any regular scar. So it's just the way I'm healing. My body is creating something that's called a hypertrophic scar. Wider, slightly raised, they appear slightly larger. So even though my surgeon used relatively small punch size, which is 0.8 and 0.85 millimeters, depending on the graft, they still look larger than that. And unfortunately, he was not able to go any lower than this punch size, just because the way my grafts are growing, they're not like bunching in one, they're like growing in one line. So forehair graft would be like in one line. So you need a bigger essentially punch to extract them safely without any transactions. So it's kind of my limitation there. And if we're going to go back and look at my videos when I bust down, after my second transplant, when I had 6,500 extractions essentially done, you can kind of see pretty clearly, you can see the white scars, But again, I'm anomaly. That's not normal. And the regular patient will have a much better donor essentially after the surgery. You mentioned yourself, with the small surgeries, you're not really going to see any scarring if you're going to a good surgeon, which is true. But still, however, I would never put in a mindset as of that, even you're going to have 500, 1,000 grafts, you're not going to be able to see any scarring. In my opinion, this can be slightly misleading just because it will be scarring for everyone. Some people heal better than the others. And some people heal exceptionally well that you literally cannot see anything. But the average patient will have some degree of scarring. It doesn't matter how many grafts you're going to extract. It's 500 or 5,000. It's just going to be more or less dots, essentially, when it comes to FE. So when I always say to people, expect some scarring, expect to have slightly longer hair on your donor area, because in my opinion, that's a really great trade-off, to have slightly less hair here and you're limited to slightly longer hair, like as a hairstyles, but you have hair on the top, right? So that's the whole goal, just to relocate, and that's it. So in my opinion, for me at least, it worked great. I had 7,700 grafts approximately over 3 surgeries now. I was on Route 5A, like I said, and I can still go buzz down my hair on the sides to guard number 2 when I go into the barber. So that's pretty low, I would say. You can kind of see the outline, but you really need to know what you're looking at just to spot it. Any other person on the street will never know. I actually challenge some of my friends, colleagues, whatnot, who don't know that I had the transplants, just to see if there's anything, if they see anything wrong or anything. I just point with the finger and they looking at it as like, what do you want me to tell? I was like, it's hair, So nobody can really see the scarring. Nobody can really tell that I had a hair transplant when it comes to hairline, density and everything like that. It just looks great. I have slightly less density, I would say, in the crown, just because, a crown, exactly. It's a black hole. Regardless of amount of grafts you're going to put, it's always going to be not enough. So it's the same case here. Once I had really thick, mid-scalp and going towards the crown, and then the actual whorl just becomes a bit, thinner. So as maximum people think is that, well, I might be losing hair just because it's slightly thinner on the crown. Yeah. That's it. So, in my books, that's a win because I was totally bald on top. So, I'm pretty happy with that.
It's interesting when we talk about scars. My first hair transplant failed. It was FUE, and I was so uneducated, didn't know what I was doing. And this is 2019. This is when I was working in Hollywood. And you're just inundated with so much online. You don't know where to go. Every website's like the number one doctor in the world, the number one this. And that's not true. There's no number one. Everyone makes mistakes. So I kind of fell into, I don't want to say the FUE trap. I did fall into the FUE only clinic. I was not educated. I didn't know what I was doing. And mine was basically just the frontal half. And I was like you, Norwood 5A. I was like completely bald. And I'll get into this later about when I stopped finasteride because I was just not educated. But after the first FUE is when I took things very serious, like for surgery. Medication as well was coming back. And I switched over to I did 2 FUTs. Luckily, I don't really know what actually happened post-op. I don't know how many grafts this doctor supposedly had done, but not a lot survived. Other doctors had scanned my, donor region. They're like, it looks like maybe 1,800 or 2,000. Like, well, I was quoted more than that, but they didn't survive. It was just really bad looking post-op. And I talk about this in length with Dr. Bloxham, my friend and partner. And, when we talk business side of this, the partnership that we have is focusing on a lot of surgery techniques that are both good and bad regardless. There's not one that's particularly better, I guess you could say, because great surgeons can do great FUE. Great FUT surgeons can do both. Great FUE surgeons don't ever do FUT. So we could say, oh, are they the best because they don't do FUT? I don't know. I mean, every surgeon's going to have their good surgeries, and some of the best are going to have really bad surgeries. So jumping back, I switched to FUT because I wanted to preserve my donor. And that's something that I was like, man, I got to preserve this. So FUT, and I talked about this on another podcast, I actually don't think it's as painful because you're just doing one strip. The pain after an FUE, it's so many punctures. It's a lot of neurovascular pain, a lot of nerve pain because you're hitting so many nerves. But my goal was to preserve the donor with FUT. And I've had 3. So FUE 1 failed, not many survived. FUT 2,500, great result. Filling in a little bit at the back. FUT number 2, Dr. Bloxham, went on the crown only to fill it in. This is my crown. I still got to work my crown a lot. That's what we're going to do next. So I still have a really good donor region. Luckily, the FUE did not take out a lot. I got lucky. FUT scars, you can barely see it. Lowest I go is like a guard 3. You can't see it. I don't really like the fade. I'm not a deep fader guy. I just like a more natural. I talk about this at length. I think the fade is dying. I like a little bit length. I like a little bit more natural look that doesn't look like you're
a more mature look, right?
Yeah, like it's not.
We're not teenagers anymore to just have this teenage, hairstyles essentially.
Yeah, I mean, some guys can pull it off, and I mean, the fade works well. The top, but we all want hair on the top. But yeah, the FUT surgeries were very successful, very high success rate. The scar hurts a little bit, but the healing to me, I think I wouldn't say better. I would say the healing takes a little bit longer because it's a deeper scar, but the outcome with, statistically speaking, you have a higher rate of survival with FUT. Surgeons will argue, oh, that's not true. I can do 98%. And some can, but if you look at the research, statistically speaking, FUT, because of the way we slice the grafts, can survive better. And just going solely off research is why I chose to go FUT again. Now, will I do next surgery? Because I don't know if I can pull another FUT, but theoretically, I'd like to just go with FUT combo, which Dr. Blocks and I talked about. I think we're going to go for like maybe 1,500 in FUT, and then maybe FUE I can do 15 or 2,000, but not a lot. And, not a mega session, just what my body can tolerate and what will heal best.
And that's precisely the right approach, multi-step approach. That's why I always preach, if it makes sense. A lot of people really want to get this, one and done, and I cannot blame them. I recently spoke with a guy who is going towards number 5, and he really wants to keep it private, and he wants to get it one and done, ideally, just because, you need to put on hold life and no business and other stuff. So I get it. Totally get it. And they're, luckily nowadays, there are pretty good surgeons, not just FUT, like used to be a gold standard for this, but also now FUE. Some doctors who can do pretty good mecha sessions with a great success. I mean, they've proven themselves that they can do 6, 7, 8, 10, 9,000 grafts in like over one surgery. I'm not saying that's the best or gold standard. Definitely not. I'm a huge proponent of multi-step approach. Less is more, because you never know. Something gonna happen. You might have some underlying scalp condition that you didn't know about it. Your surgeon didn't check. Nothing grew. And then what? You've done 6,000, 7,000 grafts. FE all gone. You have no donor left to play with. That's it. Your next stop is the hair system at best.
Yeah.
Unfortunately.
Yeah.
So exactly that's why I really like smaller surgeries, 2,000, 3,000. It makes sense first surgery to do 3,000, 4,000 grafts. That's fine. As long as the doctor is great, they checked your scalp and everything checks out essentially, then that makes sense. But then afterwards, again, if everything grew, probably you can go on for another big session, but as big as probably like 3,000, 4,000, like you're planning right now. And it's sensible, especially when it comes to FE, because you don't want to over extract. You might create too much trauma and then shock loss and all this stuff, and better to take it easy.
Well, real quick, what is your current routine for medication?
Pretty simple, actually. I am a person who doesn't like to experiment. I mean, I do like to experiment, but not with medication, because I experimented in the past plenty that I became number 5. So, now I'm taking it simple, finasteride, minoxidil. I'm taking only what works.
Are you doing oral? Because I remember you had mentioned oral minoxidil is causing some on your heart on the S&P wave and stuff.
Yes. So yes, finasteride, 1 milligram Propecia tablet form, classic. Can't go wrong with that. Minoxidil, I opt for oral minoxidil. I used to use topical version in the past, just before my first transplant, and I stopped it. I lost a lot of hair because of that. Stupid. Here we are. Then after my second transplant, I decided to give it another go. I started with oral minoxidil. At that time, it was not really popular yet, as it was right now. It was like early 2022. Mid-2022, I believe. But yeah, I've been on 2.5 milligram a day dose of Lonitin brand, so brand name. I've been ever since on the dose. I have never increased it, just because, my doctor, Dr. Ferreira, he constantly reminds me, by the way, Rolandas, we can always increase the dose if you look, I know. I rather have this higher dose just in case I ever think, becomes a bit thinner. Maybe I should give an extra boost of, minoxidil. Because the way minoxidil works, it doesn't stop working. If it works, it works. That's it. You get the boost of, hair becoming slightly thicker. And that creates basically better illusion of density. As we know, transplants is just an illusion of density. Yeah. So we need every little bit that helps, right? If I ever gonna see that my hair becomes thinner again for whatever reason, or I decide I want a thicker hair again, like a teenager, I'll probably jump on 5 milligram. But for now, I'm 2.5 milligram a day. I've done a video, I believe last year, on side effects. So I had some issues with the breathing and stuff like that I thought it might be related to oral minoxidil. So I went through here in UK through GP. I've done all the necessary checks for the heart, for the lungs and stuff like that. And to my surprise, everything was perfectly normal. Like there was, no alterations or anything like that. From my opinion, my resting heart rate probably increased slightly. But then again, I'm not getting younger. So I have no clue. But other than that, I don't really feel like I have any issues. I've been still, taking it since then. I never actually stopped, and this incident kind of, disappeared and never came back. So I contributed to some other factors, lifestyle, maybe diet or anything like that. Other than that, I don't use anything specific. There are obviously interesting treatments on the horizon coming through, but I might consider dutasterate in the future. I might consider, like I said, higher dose of oral minoxidil. I might consider topical antiandrogens, especially the ones that are coming, or even the ones that are currently available, like alpha-tridal or things like that. So yeah, that's what I currently do. How about you?
So currently I'm on 1.5 dutasteride. I wouldn't say testing, but I sort of am. My routine has changed.
High dose.
Yeah, well, there's a combination of factors that I'm kind of testing here, both hair strengthening, because remember, it strengthens your donor too. So you want to keep your donor strong. It's not just affecting the top, but also looking at my blood test too. So I'm always tracking my blood test of DHT to see, but blocking DHT also has a host of other benefits, we'll say. I mean, these are incredible drugs, finasteride and dutasteride. The side effects are quite incredible. These are very safe drugs too. And a lot of people go into this thinking, what we see online is, your libido, or you're going to not be able to use your Johnson. It's not true. I've been tracking my testosterone. I actually just got my last test. 772, SHBG is good, total free, everything is good. Now, total doesn't mean much. It's free, but I'll have to look at it again. But these medications can affect your testosterone slightly, not a lot. I'm not on TRT. I've considered TRT. I'm not on anything. I take creatine in the morning in my coffee, but dutasteride 1.5 milligrams. I was on oral. Now, the side effects I had with oral medication, and a lot of guys get these, there's kind of a higher side effect profile for minoxidil because it's a blood pressure medication. That's what it's originally used for. I got like rosacea and stuff around my face. Dr. Priest and I talked about this. You get puffiness in your eyes because you're retaining water, which is not always advantageous. So essentially, I was peeing a lot at night. So I had nighttime or nocturina, medically as we call it. And I just couldn't stand it. And lowering the dose, it was still there. So I stopped probably just 3 or 4 months ago. So I'm testing it, keeping track on my hair. I have noticed a little bit of shed, but I want to look at thickness and stuff and see, do I really need it with the higher dose of dutasteride I'm doing? Any side effects with dutasteride for me? No, I don't have any sexual side effects, nothing. I've never had any side effects with finasteride when I started or dutasteride, none. So some people might get some, and I'll do a deeper dive on this on my website about like why some men experience side effects at the very beginning. It affects your prostate, it affects your hormones. Your body is being affected by the change in their hormones because of dutasteride, because of finasteride. We're blocking that conversion. So you might feel funky downstairs for a little bit. Give it about 3 weeks and that should go away. It's literally your prostate and other areas, your skin, your hair, being affected by this medication. So I always tell guys who start, you can titrate up. And if you start to feel funky, give it some time and just ride it out. Usually it goes away. It's literally your body adjusting to this change in conversion. And most guys don't understand that. So that's all I'm doing. I'm just doing solo dutasteride 1.5 milligrams. Will I go up to 2.5, the max dose? I don't know. I feel good right now. There's no issues. Hair is still looking good. Will I test on myself? Yeah, I could. I mean, I titrated up each month, 0.5 and then 1 and then 1.5. And things are good right now. And
to be fair, 2.5 is not the top dose. That's the only studied top dose.
For hair, You can go, well, for...
I wouldn't do it, but
for prostate, you can go higher. But the research, the Olson study talks a lot about this going up and how you have a greater scalp reduction of serum level DHT as opposed to just serum level throughout the body. So you're getting, I think it blocks all the way up to like 70 or 80 when you go higher dose in dutasteride, versus 98% blockage of complete body serum DHT as opposed to finasteride. Now, some guys do really well on finasteride. I've just done a lot of studies on dutasteride. That's why I prefer it. But the best thing is to do what? Just start first. Build the foundation of blocking DHT is the first thing. Quick word from our sponsor, Mane & Steel. I started this company because of my own experience with hair loss. Mane & Steel is the first and only company in the US offering dutasteride-only protocols, the most effective medication we have for stopping hair loss and helping regrowth. Whether you're in your 20s, 30s, or 40s, or you just want to keep your hair, Mane & Steel is built for long-term results. Trust me, it's a lot cheaper than spending thousands on hair transplants. Go to maneandsteel.com and use code HEROSHOT for 10% off your first 3-month subscription. Now, back to the show.
It's important to mention that not everyone requires all-in right away, especially. Everyone's body will tolerate a reduction of DHT slightly different. Everyone has different sensitivity to DHT from their androgen receptors. Like, look at the people who don't have any hair loss. Do you think they don't have DHT? No, they still have plenty of DHT in their body. So DHT on its own is not the problem. The problem is the sensitivity of your hair follicles, of your androgen receptors in your scalp to DHT. For someone, you can just, with a 0.25 milligram of finasteride dose per day, which still, it's been shown to be effective for hair loss, not to the same degree, but for some people can work brilliantly well and they're going to stop further progression and it's going to be perfectly fine. Some people need the full 1 milligram dose because it blocks more DHT. Some of them will need to go on a finasteride to block even more DHT. So it's all about finding what works for you. I think that's the best. In my opinion, you should start from something that is a gold standard, if it makes sense. Finasteride, 1 milligram a day. If you're worried about side effects, drop the dose to like 0.5 milligram, let's say once a day, or even lower if you want. Speak to the doctor, obviously, because I'm not one of them. But eventually, build up the dose to 1 milligram finasteride and then take it from there. Because if it's working, why bother? That's why I'm not switching, because it seems like it's working for me. I'd rather have the finasteride in my back pocket again in case I need it, because in my case, I'm Norwood 5A, so I have already really aggressive androgenic alopecia, and my father is Norwood 7. So not the great genetics to begin with. And definitely I would like to keep something stronger in case I see, my crown starts going, my lateral hem starts dropping down. It's good to have this option, essentially.
Yeah, and there's something really important you said there that a lot of guys miss. When you have hair loss, it doesn't mean you have more DHT. It means you are more sensitive to DHT. And a lot of guys don't understand that. They're like, oh, you must have so much DHT. No, it's just sensitivity. People don't understand that. Your follicles, the areas that can bind to DHT, are just more sensitive to it. And that's why we lose that hair. That's why guys like Kurt Russell, Brad Pitt, they must have really low sensitivity to DHT, which is why they look great and keep their hair. So
good for them.
It's always good to talk about that. Medication, hair transplant, but let's get into some cool stuff. So we kind of discussed this a little bit. Jake Paul, Logan Paul, the Jake Paul fight.
Yeah, the brothers.
Did you watch it?
It's very difficult to miss it. It was like all over the internet when, Jake Paul was with this destroyed his face, smashed. I think he broke his jaw. So yeah, good for him. It's good experience, I guess. Going against someone that is actual professional. But when I saw this, and again, when I see the Paul brothers, I always see, especially with the Logan, the hair loss. Especially with Logan, he's been just hiding it for so long. He does a good job.
Yeah, he does a good job. It looks good for him. We know he's hiding. He showed it himself, but you're right. It still looks good with his
the problem is, I don't think he has not done anything about it. He might not say anything about it. He even said recently in some, Twitch streams, he was saying, oh, I'll go to Turkey eventually. And the same, by the way, Jake said, oh, eventually I'm going to go to Turkey for a hair transplant. But I'm not sure about Jake, probably not. But Logan, I'm pretty confident that he already had some sort of minor surgery. I have a feeling. Just because when you're looking at his timeline, in a very young age, he started losing hair pretty aggressively. He started basically the whole hairline, not just in a V-shaped pattern like we normally have, like Norwood 2, Norwood 3 goes. I think he goes from the front going backwards, just like I had, by the way. I think he was at some point when he was 21, 22, he was already Norwood 3A, I would estimate, if not higher, because his hairline was pretty much non-existent. And even, there were some pictures when he's running and his hair is all the way back. And you can clearly see the mid-anterior scalp already thinning quite substantially, and there's no hairline. Yeah. There's clearly, so that's why he started styling his hair forward with this, messy brushed look. And to me, I always see this, the other YouTubers or some even doctors commenting, oh, I don't see any difference there. To me, it's kind of silly because there is a clear difference. When he started losing hair. To me, it's the hair color. You can see in some of the pictures or videos, at some stage, his hair at the very front became lighter than at the back or the sides and this is a telltale sign, because when I was losing hair in a similar pattern, was exactly the same. At one point, my natural hair is not blonde at all. As you can see, it's mid to dark brown. Mm-hmm. But at some point before my transplants, when I was Norwood 5 already, I was having massive comb over, basically coming, from the sides, from the back and moving to the front. My hair was so light in color that a lot of people were calling me blonde, quite literally blonde. Where is this blonde hair, Yeah. So this is what happens. If you understand how hair loss works, because of the DHT, each cycle, so basically the hair growth cycles becoming shorter and shorter and shorter, so therefore the hair sheds more often. And with each cycle, as it becomes shorter, it cannot grow as long, it cannot grow as thick, and also it cannot grow as dark. Yep. So if you look at people that are Norwood 6, 7, there is almost nothing left. The peach fuzz or whatever the hair they have left, it's really light in color, almost some of them transparent. So that's what happens. Since at some point, you still are able to grow your hair pretty long, but it will be lighter in color. And this is such a telltale sign of a guy is undergoing active miniaturization in that area. And, like I said, I was looking at some of the, other YouTubers talking about it. Like, oh, to me, it looks everything similar here. Nothing changed. I was like, it's right there, man. It's right there.
We could also theorize, taking medications can change the pigmentation of, skin, scalp, and the follicles. So hopefully, if you guys are listening, I hope you guys are on medication. Please start on medication first before you go to Turkey and get
100%.
Something done. So
Step number 1.
I would assume they have access to great doctors, obviously surgeries and stuff. So I would assume that they have some personal doctors say, hey, you're on camera a lot. Let's get you on finasteride or dutasteride. So I hope they're starting there. That's the starting point. And I hope that these guys take it seriously. I know one of the gentlemen on their podcast, I forget his name. I don't really listen to their podcast. I just kind of see them in passing. The one guy who's got the buzzed head went to Turkey, but he went and got it done. I hope he's on medication as well. You got to be on medication to continue to mitigate the effects of everything. So yeah, let's hope that they do the research. Let's hope that they are not just jumping the gun and going to best hair transplant in the world and just go, I'm going there. So
it's a matter of time when it's going to happen. But you say you're hoping. I'm pretty sure they both are on medication already. Again, Jake is a bit, less probably so. He's a bit younger, but his hair loss seems to be less aggressive. Maybe because he's on medication and it's kind of slows down already, or maybe just naturally. But again, Logan, he's been bald so quickly, and it happened again to me in the same way. And then at some point we see it's strengthening quite substantially, kind of goes back to the color becomes thicker. So I'm pretty sure he's on all sorts of medications, especially knowing that they both, abusing probably PEDs so for, the wrestlings and the boxing and stuff like that. So naturally, you want it or not, you must reduce your DHT levels, because if you're susceptible to baldness and you're going to abuse testosterone, come on. It's a one-way street. We all know what is going to happen, So I can guarantee they both already on medication, or at least Logan. And I think, like I said, Logan has definitely some small minor transplants to make it look like he didn't have one, but also so it doesn't look like he has some severe baldness. Yeah. Because at some point, if you're going to look again, in like 2000, maybe 22, 23 or something like that, when he's looked like brushing back, shows the hairline, and it you can kind of see slightly defined. It's still thin, but there is some definition to the hairline, while before there was no definition at all. And, in his native hairline was actually slightly different shape as well. So that was altered. So that's why I'm personally speculating he already had one. But yeah, it's a matter of time when they're going to promote some Turkish clinics, 100%. Turkish clinics, they're so good at marketing. They offered probably free surgeries to everyone and everyone on YouTube nowadays. So I can guarantee they already have probably dates even booked and, planning ahead.
I'm sure they've reached out to them multiple times. You also brought something up about PEDs, and, testosterone is a steroid. This is the one place where you do increase your DHT. If you're taking exogenous steroids, you have a greater amount of DHT coming into your system. So again, that's kind of where we get more DHT, not in our body, but your sensitivity stays the same. But if you're on PEDs and you guys are on testosterone or steroids, do what you like. You should be on a 5-alpha reductase inhibitor to mitigate the symptoms of allowing more DHT to come into your system because you're on an exogenous steroid. So that doesn't necessarily mean that your sensitivity increases. It just means there is more to deal with. You're going to have to bulldoze away a lot more DHT coming into your system. So a lot of telehealth clinics who do offer testosterone will say, hey, we'll throw in oral finasteride with it or dutasteride. So I'll applaud them on that. Do they know how to dose it appropriately? No, it's like a commodity now. It's like gold or silver. They're just throwing it in there, but they're not knowing the dosing appropriately. So if you're on PEDs or TRT, you need to mitigate the effects. I mean, it's harmful effects. DHT does a lot more for your body. It ages you rapidly, makes you lose your hair, it affects your prostate, everything. So if you're on TRT, but you're not losing your hair, should you be on a 5-alpha reductase inhibitor? I would actually say, I would say guys who are on TRT, maybe you're not blasting, but you're on a regular dose. There are still downstream effects that can be deleterious to your body, your prostate, your skin, your hair. So even if you don't have hair loss, I would still recommend guys get on a 5-alpha reductase inhibitor at a lower dose if they're on TRT or steroids, just to mitigate those symptoms. So
yeah, it is possible. And I want to circle back to the same, what I mentioned earlier, that some of the bodybuilders, huge ones, they have zero hair loss. How is this possible? they must have huge amounts of, DHT in their body, yet they still don't lose hair. It's like a joke became that people say, oh, as soon as you start blasting, you're going to lose all your hair. Not necessarily.
Not true.
Yeah, exactly. Yeah. If you're not sensitive, your hair follicles are not sensitive, you're not going to lose. So some people lose very small amount. On another hand, if someone would be destined to become, let's say, Norwood 3 only, just slightly corners and that's it in their lifetime. So it means they already have some sensitivity to it, and you start blasting and your DHT levels start rising, through the roof. You might actually become Norwood 6 just because you already have programmed in you within your androgen receptors that, hey, if you're gonna give too much, I'm gonna throw away your hair, essentially. So, and I've seen firsthand, into the gym that I'm going, there's some young guys who quite clearly you can tell that started using some exogenous drugs because just how huge and how quick they grew. And you can tell by the hair as well. It was such a full head of hair, now slowly starts decreasing and the density. And now I saw the guy the other day is like shaved completely.
Yeah. In the DPT program, being a doctor of physical therapy, there's a large portion of pharmacology that we go over. And in particular, I remember we spent about a week and a half talking about performance enhancing drugs. And, I've seen a lot of charts and stuff, and you learn the telltale signs of guys who are, we'll say, blasting or on TRT. Younger guys are more susceptible. They get acne and start to thin out. The hair looks thinner. But with regards to that, guys who have low testosterone as you age, testosterone can actually help your hair not grow, but helps the quality of hair on your body, right? It'll still make you lose your hair if you're sensitive, but some guys will have some weird alopecia because their hormones are low. So it's not always that we're saying testosterone is a bad thing all the time, but sometimes testosterone helps overall with your body to improve growth, to improve everying in your system.
Yeah, it has to be a balance, right? Like in everything in life. If it's too little or too much, it's out of range, essentially. That's why there is in all the medical charts, there's a range. What's the minimum, what's the maximum, that's you're within that range. If it's below, well, not great. The same with testosterone, the same with everything, essentially. So it's important to know that the balance might be off when it comes to the ratio between the testosterone, DHT, to estrogen as well, that can cause all of these issues as well. So it's not necessarily just the DHT, just the testosterone. It's always worth, doing some blood work, extensive blood work, and speaking to a doctor who actually knows anything about it, especially if you take any PEDs. Yeah, I'm obviously not an expert in this, so I'm not going to be commenting much.
I usually add the DHT to my blood markers when I go and get my blood test. I'll add it just because I like to see. Now, it's inexpensive to add it. I mean, I think it's like, depends on where you're getting it, $35, $50. It's not that much, but you can literally track. I've got a client, I said, hey, let's do, DHT tests in your blood. And then how about in 3 months, we'll check it again and we'll see where your DHT is now that you're on dutasteride. So it's just good to see those markers to see, oh, it's having an effect. Do I see the effect? Yes. Do I see the effects in my blood? Yeah. It's great to get a visual both internally and externally to see what's actually happening.
I've done one check in the past in 2022, I believe. When I checked the DHT, that's the only time when I checked, I was actually abroad and it was so much cheaper. I was like, let's do the whole 9 yards essentially, just for fun. And back then I was already on finasteride 1 milligram a day for the last probably 3.5 years maybe. So it was stable. My DHT were at 249 nanogram per liter. So, and the range was from 219 to 1,100 for men. So I'm on a lower end, but still not below that. So I can only speculate if I would be on the dutasteride, I would be below the range for sure. Tests themselves. So the number itself is not really going to tell you anything. So yes, you're going to tell you where you are, but it doesn't mean whether you're going to be having hair loss or not.
Correct.
Again, going back to the same thing, you have to have sensitivity, which is unfortunately impossible to test. I wish there would be some tests like that.
Well, there's a lot. There's some, I would say, competitors of mine in the hair loss space. We see DNA testing for hair loss, which there's no DNA test for hair loss because there could be a gene that is altered in birth. There could be a chromosome and you get hair loss. Everyone in your family has a full head of hair and then you end up with hair loss. Now, is a DNA test going to do that? No. You would have to have the most extensive DNA test. Theoretically, could it be done? I don't even know the blood markers to look at. So guys are paying $200 and some to get a DNA test to determine if they're going to lose their hair. And it's like, well, if it's coming from a manufacturer who's selling hair loss medications, you think they're going to say, no, you don't need drugs? They're going to say, well, you could be susceptible, so we want to put you on these. So, like you said, testing
that's
doesn't show
everything. You might be susceptible. It's not a guarantee. So to me, this is almost like a scam. Like, well, we can speculate looking at this biomarker and that biomarker that yes, you might have. But then at the end, they're probably going to go and look at the pictures of your father and grandfather, and then they're going to tell them. That's the easiest way. You don't need to have any, blood work done. Just look at your parents. It's pretty simple. My father is bald. I'm going to be bald. If you're not going to be bald, consider yourself lucky. Let's put it this way. It's very rare.
Yeah. One other guy I wanted to mention, in addition to the Paul brothers, was Justin Bieber and his hairline.
Okay.
And I tracked him a lot. Like, I was like, man, Justin Bieber's losing his hair at a young age, and he still has a very youthful look. He's lucky DHT hasn't really affected his skin to age him because he still looks young. And I have no idea who did his FUE. His hairline, it's very sharp. It's very youthful. It looks great. I have no idea who did it. You can't even tell anything, but obviously he did have a hair transplant because he used to hide his hair for a long time. If you look back at his socials, I was like, man, when's he going to show his hair? He was wearing a hat all the time.
No, definitely.
And finally, when he revealed his hair, I was blown away. And I sent it to all the guys in the hair loss space. I was like, oh my God, does anyone know? Can I just applaud the doctor if you're watching? Great job. I don't know who did it. Justin, maybe you'll say you don't have to, but maybe you will in the future. But he has one of the most undetectable hair transplants I've ever seen for how he buzzes it. If you go to his socials now, and as we do this, I'll try to post photos overlaying us. His hair looks great. He looks younger than he did 5 years ago when he was like really losing his hair and had his mustache. He looks incredible. He looks like he's 25 years old. I don't actually know how old he is. I've seen him once when I lived in Hollywood. I saw him in Burbank in his blue Lamborghini, parking somewhere, nice, going to some breakfast place. But he didn't have his hair transplant then. He was wearing a hat then, but now he looks great. So I applaud him and his surgeon.
It's something I mentioned as well in one of my previous videos as well, that being a celebrity doesn't automatically mean you're going to get the best transplant, and vice versa. If you're looking at celebrities like Justin Bieber and you think, well, of course he has all the money in the world. Of course he's gonna have. It's not applicable to me because I'm poor. I don't have no money.
Yeah.
That's not the case. There is no magic. There is no automatically something that is like behind the closed doors only for the richest of the world. No, all the transplants are done in the same way. It's with all due respect, it's not a rocket science. There's nuances. It's a very artistic and skillful art essentially, but it's not a rocket science. It's as simple as you're moving from location A to location B here. Yeah. How you do it, that's obviously the art already, to make it look natural. So it applies to everyone. There's plenty of surgeons that we know all around the world that can create extremely natural result that it's going to be undetectable. And it's all about choosing the right surgeon. I can guarantee you can go to the same doctor where any of these famous people like Elon Musk, for example, another great example. It's like some people didn't even realize he had a transplant until they see some picture of him earlier before that where he was like pretty bald, basically.
The McLaren video. Look at the McLaren when he had the McLaren delivered to his house in San Fran. That's when he has. It's weird. His whole look is different. Like Elon's huge. He's like 6'2", but he's very big. If you look at the McLaren video when he gets his McLaren delivered, he doesn't look as tall or as big as he is now. And something that always is interesting too is of all the podcasts, no one's ever said, hey, yeah, I saw when you buzzed your hair down, you had the 2 FUE. No one's brought, maybe he just says, don't talk about my hair. I don't know. I wish he would. He talks about everything. It would be great to have him say, oh yeah, I just, I care about my hair. I did this. And you can clearly see his 2 FUT scars when he buzzed his hair down. But when he just lets it go out a little bit to even like right now, I think he's got like a guard too. He looks great. His hairline is held up. I'm sure he's probably on some medication, but another great example of the test of time for hair transplants and medication combined, they do last long. And there's some times when he was midway through Tesla where he's a little bit thinner, his thin face, his jawline, his hair. He looked great. He looked really, really good. And his hair was a testament to that, to really helping him. He looked like just a youthful tech entrepreneur. So he looked great. And then Steve Carell, you said, your video on Steve Carell was great. And I never thought about what you said about Steve Carell was that possibly he had an FUE prior that was not that great. And I was like, oh man, you're right. Because you could see it's a couple doubles, not even singles in that hairline.
Yeah, there's some thicker grafts in the very front. How is it possible that there's some thicker hairs?
And then after, which I think he probably switched over to an FUT, to be honest with you. And Spencer Corbin talks about this. I think he switched over to FUT. His hairline looks great. He's grayed out a lot more, but the women call him the silver fox. He's got a great hairline, very mature, very natural. Great job on if it was a second one, and I'm sure he's still on medication too. And then we also want to chat. Joel McHale is very open about his hair transplants. Dr. Mohebi, I think he had 2 FUTs and then a couple FUEs. I can't remember.
His case is very interesting because although he's super honest and open about it, he's always talking about it. But what I like about his particular case, even though he had multiple transplants, he never went very aggressive. So he kept relatively high, relatively preceded Norwood 3, you can call it, maybe slightly lower hairline, not a perfectly low. And he just keep adding density. It
looks great.
Keep adding density.
Density to his hairline is really good.
Just density all around, like perfect. Like he's been born with this essentially, And that's what I like about it, because you don't have to go this super boxy low hairline to look like you're a 12-year-old again,
This is a really important topic you bring up, and Dr. Bloxham and I talk about this. In my case, I don't have a full, I'm not as thick as I want to be, but even having a little bit of hair, let's say you're already a Norwood 2 or Norwood 3, just getting that thickened up, just having hair on the top of your head, guess what? You're not bald anymore. Like you and I were almost completely bald. Just getting a little bit to start with, it changes the way you look. Like it really does.
Yeah.
It changes everything. And if you go slow, you're like, oh, this looks pretty good. It's not too dramatic. And then in Joel's case, his hairline, it looks like he's not receding anymore. He's not going to lose any more hair. Hopefully, he's probably on medication, but it looks great because it's actually a receded, thick hairline.
It looks like a mature hairline. Surely it's slightly receded, but nothing crazy. It's something you would normally expect, from a guy of his age to be like this. And it looks amazing. Like, of course, his forehead, I believe his even natural, native hairline was never low as well to begin with.
No.
And that's why probably they even decided to stop there and not to go any lower. Like in my case, to be honest, if you look like right now when I'm doing the wrinkles, it's not really that much room left. So I could go very slightly lower and that's it. So, my natural hairline was not really that low as well. Like people say, oh, your hairline is too high. Like, everyone's different.
I'll post me in high school. I got this black and white shot when I was playing soccer with my American Eagle necklace when I had nice hairline. You'll see it's not much lower than it is now. My temples are better. And we're going to work on that. Dr. Bloxham, I kind of fill my temples in a little bit to give that more angular appearance, but I'm not going lower on my hairline, but I'll try to post that as well. Because temple points tend to get forgotten quite a bit. They're hard.
Yeah.
And another guy I was thinking about who popped in my head, I had that long list I sent you, was Timothy Oliphant. If you look back at him back in the late 90s, early 2000s, he is receding quickly. If you look at him now, the way his hair grows is very thick and straight. He's got these incredible temple points. Like they redid his temples and his hairline just very mature enough. I think he was recently on, I forget, a late night show, and his hair, it's gray, but he looks great. His temple points are like that thick where they're like, whew, they're thick strands. I'm like, my God, to have temple points that you can flow back looks great. But whoever his surgeon was and the rest of his hair, they did a great job on his temple points and just subtly bringing down his hairline. He's another guy I'm just like, man, just subtle changes. And you're like, if you see him on TV 10 or 15 years ago, you're like, wait, his hairline's way, and then you see him now, you're just like, man, he looks good. And so it's really difficult to understand that celebrities are not getting a magic bullet to fix their hair. So many people think this. If you go online, they have all the money in the world. Everyone get a hair transplant. Go to Care Credit. Get a loan. They're low interest rates. The majority of people can't afford to get a small hair transplant to start with. You don't have to get a $30,000 transplant with 5,000 grafts to fill in a Norwood 3, right? You just need to start somewhere. And there's options available for everyone. The best place, start with medication first, and then look at your credit options, look where you can go, because everybody has access to the same doctors. These doctors aren't doing one transplant a year on one celebrity. They're doing multiple. Mohebi says this. He's the celebrity hair transplant specialist. He lives in it. He breathes it. So it's not like he's going to change his prices for a different person and be like, oh, I'm going to charge celebrities.
I mean, to be fair, he probably can. He's going to close the clinic, close the whole sector, around the clinic, so nobody going to see the celebrity coming in.
They do that, yeah. I mean, possibly the day of, but most surgeons are only going to do one day of, and you're going in early. Paparazzi's not going to be out there trying to go to clinics and look at people. It's also illegal to do that. If you're near a medical clinic, I worked in a medical clinic in Hollywood. We'll talk about that later. You can't step into our clinic and take photos. They tried to do that. I was right in the heat of it. But their surgeons are doing transplants on regular people, not just the celebrities. And they're not going to tell you. Some surgeon will say, oh yeah, I worked on him. He's openly talked about this. But there's so many celebrities that get hair transplants that are unnoticeable. I will say this right now. They're probably paying the same price. The doctor's not going to charge them more. That is not how you do this in the medical field. You don't screw someone over because they're rich by charging them more. You have standards. We have standards in the United States with medical care. You can't just say, oh, I'm going to charge you more because you're a celebrity. A celebrity hair transplant costs the same as your transplant. It's no different. They're not going to upcharge because they're a celebrity. That's not how this works. So talking about that, I'll jump into my experience, I guess, living in Hollywood. I lived there
I
for
was
like
about to ask. That's really insightful. I guess I was looking forward to hear more about it.
So my girlfriend and I left Florida. We were in graduate school at University of Florida. I'm a doctor of physical therapy by trade. We left Florida and moved out to LA. And you're kind of in the heat of everything. And I didn't expect to be working in Studio City in a clinic where there's a lot of celebrities coming in. So I worked both as a physical therapist in a clinic in Studio City. And then I was also a home health therapist, which also I just quit all the studio work, or in Studio City, I quit all the outpatient physical therapy, and I just became a home health physical therapist. But my time working in the clinic, I was exposed to a number of younger celebrities, older celebrities. I had a lot of TV actors, basically, because we were right in the heat of it. I had actors who were getting surgery here in LA, and they had to get back to New York in 6 weeks. So I have access to their medical charts. I can't legally say any celebrities I've treated or anything like that, but I can say a majority of the older men, a lot of guys are on Propecia, not just for hair loss, because people tend to forget as you age, what happens to your prostate? It can go up. So some of these guys, I would just say, are you on Propecia for hair loss? Your hair looks great. Some guys I treated had great hair their whole life, and they're like, oh no, it's for my prostate. I'm like, oh, okay. You know, it also helps with your hair. And they're like, oh, I think I know that. Yeah. So a lot of these guys don't know about it. Some of the younger guys I would see, I think I encountered, I was talking to my girlfriend this morning before you and I chatted. I encountered one guy who actually had a hair transplant. He was a producer. And he's like, oh yeah, I just got my hair transplant. I'm on finasteride, which is good. He's taking a medical-based approach. But Hollywood in and of itself, it's the nature of the beast to look good, right?
Yeah.
So a lot of younger celebrities, I treated a lot of kids who were in Nickelodeon and Disney, to a lot of young actors who were on television series, and a few who were in movies and stuff. All relatively nice, I'd say. Really good to know them. But I see their medical charts. I see everything. And the older guys are on Propecia. They're on finasteride. A couple guys I remember were on dutasteride, and they were on it for hair loss.
There is no secret sauce. There is no secret sauce. It's all the same thing.
They're in front of the camera, and they need to preserve this. And Dr. Bloxham and I also talk about this in length. I think he had mentioned a time, too, where he had a celebrity he had to work on, and they were going back and forth between FUT and FUE, and he was trying to explain to them, hey, if I do an FUT, we don't have to buzz your head. We can get this done. You'll start to heal. You can wear a hat. You're not going to be completely bald by me buzzing your head for an FUE. We know there's no shave FUE, but that's not really true because you have to shave certain parts. So he had mentioned where, you know, he's saying if you're on camera, and this is true for a lot of guys, if you're a celebrity, if you're on camera, when you're doing over shoulder shot, an FUT is not going to show if you have a guard 2 or 3. Now, I'm not opposed to either surgery. Go with what works best for you and what you go with your surgeon. But on camera, could FUE, if you're buzzed down, show? Yes. Could FUT? Yes. But it doesn't really matter. It's just what is the best for that person. When do they need to heal? Healing times change. But celebrities want hair to look good. And another thing we're going to talk about, a lot of celebrities actually wear wigs during movies. And that's a whole nother topic, but this is also true. They might have great hair, but most times they're putting wigs on these celebrities, which a lot of guys don't.
It's not only wigs. They're using fibers. They're using all kinds of things, concealers, just to make it look perfect. Like, people keep forgetting, you know, when they're looking at the, you know, movies, the pop singers, whatnot, they preparing them. They have the makeup artists that preparing them for the stage, for the movie, for everything. And that not just doesn't include, you know, the face, but hair as well. So they do everything. Never compare yourself to whatever you see, or, you know, from all of the celebrities. It's never going to be reality. You're never probably going to see.
This is a really important topic. And Bradley Cooper wears wigs. People don't want to hear that, but he's had surgery too. We can say, he looks great. Everyone's talking about his skin, and he's always, you know, he's getting Botox. I don't care. We care about hair. If he wants to wear a wig because he doesn't have a full head of hair from hair transplants, who cares? Let him wear it. It's been pointed out. I think he looks great. If it's a wig, a system, whatever you want to call it, it's all the same thing. It's unnatural hair that's added. He looks great. Let him look good. If he wants to look good for the camera, because he's on interviews, because he's in the public facing eye, sometimes hair transplants don't give you the result you want, or you're never going to get that full density. So you're going to wear a wig. Why? It gives you more options when you're on screen, when you're in interviews, and you can do. John Travolta used to wear a wig, and everyone knew he was already bald. But guess what? He looked good. He looked great with it. Does it really matter at the end of the day? Whatever makes you feel confident, do it.
Exactly, precisely. And I just wanted to say that people are going to say, why this guy just doesn't go and do like a massive, you know, FE, just lower it down and stuff like that, and just call it a day, and he's going to look great. No, celebrities, first of all, don't have time for this most of the time. They have schedules. When you have a transplant, that's something that I've discussed with one of my clients on my consultation recently. He's the same thing. He tries to keep it private, but also he needs to rearrange his whole life for the next 4 to 5 months around the surgery. It's not possible for everyone. It's difficult. So that's why in some cases, it makes sense to have one large surgery. In some cases, some of the celebrities, even, the Paul brothers, if one of them, let's say, had indeed a transplant, why they don't go like low? Because it's going to be obvious. People don't want to, look like they're losing hair, because some people have still this, stigma around them that, oh, if I'm losing hair, I'm a loser or something like that. So they don't want to talk about it. That's why they're trying to hide it. I mean, I never cared about it. That's why I'm on YouTube, I started talking about it. But to some people, it's a very sensitive topic. And a lot of people, actually, they do not want to talk about. There is plenty of amazing doctors, especially in the US, as an example. But on forums, people constantly say that, oh, but all of these doctors, but where are the results? Nobody wants to talk about it. Nobody wants to discuss this. The same Elon Musk, why never mentions about his hair transplant? Because he doesn't care. He had issues, he fixed it, move on.
Exactly. That's a great point. And that's something that a lot of guys don't understand. And people will get stuck in forums for years before they take action.
Yeah.
And I always tell people, you know what, get on a medication and get offline. Talk to doctors. You do consultations, but you have the experience to speak about these things. Guys will go on Reddit and just waste their time listening to people hiding behind profiles that have no experience in this space, telling them what to do. Just start somewhere. Start with medication, close Reddit, close all these forums, go to real experienced people who have had hair transplants, who are on medication, who are willing to talk to you. I say this all the time. Just get around people who have had transplants and they're not scared to tell you everything's going to be okay when you start medication. You have to start somewhere. Otherwise, you get in this hamster wheel of just reading and second guessing and not taking any action. And that's the worst thing. I built my business around helping guys not make the same mistakes I made with hair loss, because we all have made mistakes. And I wish I knew then what I know now about number one, starting early. And that's the most important thing, is just to start early.
It is the most important thing.
Less is more.
If you look at the study, 10-year-old study on a Japanese man that done on finasteride, basically that study shows that the earlier you start with the 5-follicle reductive treatments, the better results you're going to have long term. Just as an example, if you're up to Norwood 5, or let's say up to Norwood 4, between Norwood 2, 3, 4, if you start medication, in the next 10 years, the medication will continue improving your results. It's not that at 2 years you're going to plateau and that's it, you're going to stay.
It's compounding.
Exactly. And over these 10 years, it's been proven and shown that your hair will slowly get better and better and better. But if you're Norwood 5, after 2 years, your results plateau and they don't go any further. If you're Norwood 6, after around 2 years, your results actually drop, even if you stay on medication. If you know what 7, even deeper decline. So the takeaway from this is to start medication as early as possible. The earlier you start, the better success, lifelong success, essentially, you're going to have. So that's what I always try to, to preach as well. Don't wait until you're going to become Norwood 5 like I did and then just do this stupid mistake. You're just missing out, essentially. And I've tried everything and anything you can think of when it comes to natural hair loss treatments. Everything that doesn't work, essentially. I've tried the scalp massages I've done it for probably 8 months, but religiously. 20 minutes in the morning, 20 minutes in the evening. There is a proper protocol from this guy called Rob English. I've done that. I've done, all kinds of idols. I've done soap method, the tablets. I've done the topical soap method. I've done, obviously, shampoos, whatnot. I don't think I've tried onion juice. Frankly, I didn't want to smell,
I just posted a comment on, what's his name, in London. He just posted about onion juice. And I just said, yeah, I'm sure some hair loss company, one of my competitors, will put onion juice in a topical and say, hey, we've added 0.5% onion juice to this topical to help, because
100%. Guaranteed, as a
all
matter
the
of fact.
influencers are saying it, so we want you to have it. Yeah, start early is the biggest thing. Start on medication, and less is more in hair loss. And I try to preach this. Less is more. Do you need, this is something I talk about a lot. Do you actually need minoxidil? You don't. You can start on finasteride or just dutasteride. I will say this. I've got a lot of clients right now on Main and Steel who are just on dutasteride. Some guys are on finasteride. You can start at the lowest thing first. You can start on a 5-alpha reductase inhibitor, and sometimes that's all you need. You don't need to add topicals. You don't need to add an oral minoxidil. Some guys need it. I think oral minoxidil actually works really well pre and post surgery, right before surgery. You can't take it while during surgery because it has effects with blood pressure. But I think post surgery, if guys just want to go on a cycle of oral minoxidil to help with post-operative healing, there's options like that. But it's really important to just start and start with the most minimal thing you can, which is a 5-alpha reductase inhibitor. Just start there and see what happens. You might be surprised. Let's say you're younger. If you're like me, where you're losing your hair in college, if I knew then, I would have ended up not needing hair transplants. I probably would have come out of college, like you said, with the compounding effect, with better hair, graduated with better hair, with less embarrassment most of my life, which is a topic we haven't talked about, is the psychological effects of hair loss is huge. And it has plagued me my entire life. I think about it every day I wake up. I think about it before I go to bed because it's there. I wish I would have hair like some of my friends who have never lost an ounce of hair. But there are very strong psychological effects to losing your hair, which is why I stress to young men, start early. Save your hair. Just start early. That's like the most important thing.
100%. I've been, again, in the same rabbit hole. My whole life was, before the transplants, was kind of the same, especially when I was trying to hide it. With this massive comb over, I was already Norwood 5, so I had to comb it, a huge comb over, put a lot of hairspray so it stays in one place, it doesn't move anywhere. Looking back now at the pictures, I don't even understand how I thought it looks good. It's so obvious, it's stupid, I don't know, but you're just brainwashing yourself essentially. You're just gaslighting yourself to think that that's good, that's great, and it will work out. Nobody knows, nobody sees that you have hair loss. Like everyone does.
What do you think about young guys? Let's say you got a guy who's 24, Norwood 3, he's been on finasteride or dutasteride for 2.5 years. What are your thoughts on younger guys who have stabilized hair loss? Let's say stabilization is first. So let's say you're 3 years into stabilizing your hair loss, 24, 25, or 26. Norwood 4, we'll go a little more dramatic. What do you think about getting a hair transplant in your 20s?
Nothing wrong with that. I have nothing wrong having when you're 20, when you're 25, when you're 30, when you're 60. The problem is not necessarily your age. The age is a big factor, especially when you're younger, but there is other aspects that you need to reassess. So if someone would come to me, obviously, again, I'm not a doctor, I cannot advise, but my mindset, if I would be in that person's shoes, I would look at my family history as a baseline. If I'm 25, let's say, that's when normally good doctors start performing transplants. If you're that age and let's say you're Norwood 4, but your family members of the male members, they don't have any further hair loss, they have Norwood 4 as a maximum, that's it. Chances are you're not going to progress any further, maybe to Norwood 5, but definitely not Norwood 7. Because everyone fears that if you have hair loss, you're going to become Norwood 7, slick bald, that's it. That's not true. It's very rare actually to have Norwood 7 gene. Like most people are going to be Norwood 4, Norwood 5, maybe Norwood 6. A lot of people, like at least in Lithuania where I'm coming from, they see slight recession on the temples, that's it, they shave their head. That's it, I'm balding, shave it off. To me it's weird, I mean that nothing is wrong with the rest of it, but some people care more than the others, some people care less. But the point is that in this particular case, if the family history checks out, essentially that there is a chance that you're not going to progress any further, you're on medication, your hair loss stabilized and looks great, there is a good chance you might really benefit from a transplant, because then you're going to not just change the way you look, you're going to look better, likely, if you're going to do a good transplant, but also your mindset. It's going to be much easier to go through life because it's going to be one less thing to worry about. Especially at a younger age, you have all your life ahead of you. You're building your, your career, your life, this and that, so many things, your relationships. Trust me, the last thing you want to worry about is your hair, because then it's just your confidence drops down. It's not a great place. Again, talking from experience, it's not a great place to be. If that would be bothering me a lot, I would just get a transplant. But again, make sure it's the right doctor when other things checks out. But on another side, if you're Norwood 4, you're on the medication stabilized, but you don't really care that much. Well, surely you care, you don't want to become bolder, but then it doesn't really bother you. You're not, stressing, you're not looking in the mirror every single day and looking like in your hairline. Maybe you shouldn't have a transplant. You don't have to. If you feel comfortable as you are right now, surely there's always can be like, oh, would be great to have, right? But with the transplant, you have to take it seriously because there might be complications. You never know. Even in best hands, things can go south. So it's at the end of the day, it's a surgery and you have to take it seriously. So I think if it doesn't really bother you, you shouldn't do a transplant. But if you live your life and you're just stressing about it every minute of it, you cannot go outside when it's raining, when it's winding, then it's probably a good idea to just for your own peace of mind. That's how I look at it.
Yeah. And I think that that's a really important point is you have options and how you feel is going to affect what you do. Right. For me, it was very embarrassing. We all want to have a great body, great hair, great face. And hair is really, really important to a lot of us. If it's not, it's okay. Like I don't tell guys, they're like, oh, I don't care if I lose my hair. I'm like, okay, we can help you, but it's not a problem. But when you're younger, it's really, really, really embarrassing to be losing your hair when you're in college or when you're in your 20s. And I, like you, I believe that if I knew then what I know now, I would probably have started earlier and probably said, I'm going to get a hair transplant in my 20s. I'm not scared. I'm not embarrassed. I mean, I openly talk about it now to everyone, and I think that's great. But when you're younger, you live a life of fear from losing your hair because it's an acceptance. It's almost like the stages of grieving. Hair loss is like going through the stages of grieving, right? You have to like get to that acceptance phase before you can take action. And once you get to the acceptance phase, that's when you can take action. And I hope guys get through these phases faster. And I would say in today's world, today in the future, it's a lot more accepting. You know, it's kind of like for women, for like breast surgery, a lot of women, oh yeah, I had breast implants. It's in passing. And for men, I'm glad to see that we as men in general talk about it more. We address it more. Yeah. I address it with my friends. I'll be at the gym and I'll be like, you're losing your hair. Start on medication. No, I'm not losing my hair. I'm like, I'm your friend. Yes, you are. This is a place of help. And I think today's world, today's culture, today's social aspects, it is more accepting. I wish it was more accepting like it was when I was in my 20s, in the early 2000s, because I would have taken action. I see nothing wrong with young men getting on medication, getting a hair transplant. Obviously, you don't want to do a hair transplant when you're like 18 years old. Get on medication. Let's wait till your body matures, till your brain matures, meaning I was nowhere near as educated, smart, or understanding of the world around me when I was 23, 24, 25 about hair, health, and everything. But today's world, that's changing, right? Guys are becoming more educated. There's information everywhere to educate you on what works, what doesn't work. There are guys like yourself. There's so many YouTube channels that I flip back and forth from, Hair Cafe, KWRX. All these guys are providing a wealth of information. Matt Dominance, everyone's out there helping. There's one goal, right? The goal is to make you feel comfortable and to help educate you appropriately on hair loss and to make sure that you're taking the right paths. And I always tell guys, watch and consume things that are producing a positive message and wanting to help you. Really, that's what's one of the most important things. And youth hair transplantation, I don't see anything wrong with it so long as it's the right time, medication is been implemented, and you have a good surgeon and you've done your research. I tell a lot of guys, I'm like, don't get a hair transplant until you've spent 1 year researching. Take 1 year.
That's a really good timeline. But not just I know about the transplant and then I don't do any research. Oh, it's been 1 year. Let's book it now. In my opinion, 1 year is from the time when you actually actively start
exactly
researching. So you genuinely want to know. Because a lot of people, the problem is with a lot of people why they all go to Turkey. And I should have mentioned earlier why people think the celebrities have better transplants, or available better transplants, because the standards in everyone's eyes are so low nowadays because of Turkey. Well, not necessarily Turkey, but Turkish style. I mean, let's be honest, there's a majority of the Turkish hair transplants are total crap. And they're really brilliant doctors, one of the best in the world, in the Turkey as well, but there's minority. So it's just the standards drop down. Everyone's saying, I'm going to have a transplant, I'm going to go to Turkey. That's it. So that's the standard. And that's why everyone thinks now, if you have something good, it looks fake. As an example, I've posted some, reels, TikToks recently, some like my before and after. And some people still commenting, this is impossible, this is weak, what medicine did you take? And I'm like replying to every single comment, this is a hair transplant. And they keep asking, what medication did you use? How did you treat? How is it possible to, and they're like, hair transplant, hair transplant, hair transplant. And they cannot believe it is a hair transplant. They see the hair transplant from Turkey, you can tell it's a hair transplant. Even a person who doesn't know about any transplants, they still can tell, oh, you've been in Turkey. I've spoken to some people who know nothing about the surgery, but even then they can spot, oh, this guy has been to Turkey. How do you know? Well, I can tell he has a nice hair, and that's what they say. But like, no, the hair is,
that's an important point too. Clients, patients can go to a great hair transplant surgeon and not get the best results. Another guy can come in, get the same exact surgery, the same number of grafts, and have a totally different result, a great result. Why? Because of anatomy and physiology, because our bodies are literally different compared to healing rates, the effects of surgery and everything. And yours, we both had 3. I still need more work because one of mine didn't take as well. But that doesn't mean there aren't options. It's just that everybody heals different. Every transplant is going to be a little bit different. Consistency with results. We'll see doctors who continually produce great results, but that doesn't mean everyone across the board has the same exact result. It's just that some guys just get great results. It's just the nature of the beast. That's how this works. It's surgery. Some guys, I've treated patients who never recover fully from like a knee replacement or a hip replacement or a shoulder replacement. I've had back surgery myself. I'm not 100%, but I'm feeling great by being to 90% before when I was like in so much pain. So that's very important for guys to understand. Even having a little hair, like I said before, just getting some hair on your head really changes the way you look. It changes the way you feel too. You feel confident. I still need to get my crown filled in, but guess what? When I go out with my girlfriend, when I'm walking around, getting my hairline fixed and all this, I feel confident and I feel good. And guess what? I'm not losing any more hair because I've stopped all that hair loss with medication, with transplantation. So it makes me feel confident. And it also makes you feel confident going through the surgery. It's kind of scary if you've never had surgery. I've had back surgery. I've had hair surgery. Surgery is scary. And I tell guys, don't be scared. It's okay. If you've had surgery before, you'll understand what it's like going into surgery. And this is an outpatient surgery. But getting over the hump is a really important thing, especially in surgery. Your first surgery, it's kind of like, whoa, it's like, what the hell happened?
Yeah.
And then you're like, all right, I'm ready. If you have to get multiple, which a lot of us do, the second surgery you're kind of excited for, right? And you're just kind of like, all right, we're going to get some more density.
You already know what's going to happen.
Exactly. If you know the doctor, you know the results you've had before, you know what to do, the steps to go through, you know and feel confident going into that surgery. And you know what to do to maximize your results with outcomes and everything. And it just kind of becomes a better process. So I would say this, once you're fully accepted about losing your hair, the process of growing your hair back is actually a good journey. And this is a long journey that we're all on, right? And you start to feel really good when you start to mitigate the symptoms of hair loss in all aspects of your life. And I say this all the time. When guys start taking care of your hair, if you're losing your hair, you start to take care of other things in your life. Your workouts 100%. Will be better. You'll be like, I'm not going to eat this. I'm going to have this bowl of fruit instead of this cookie. It's so weird to say this, but when you start to take care of your hair, everything starts to get a little bit better. I can't even describe it. I'm sure you felt this way, but like 100%. Your life changes dramatically. The way you walk, the way you talk, the way you feel. It's
psychological part. And I will tell you, at least in my opinion, what's happening is most people, when they start losing hair, they feel like, they're losing hair against their will, essentially.
Hopeless.
So they are become hopeless, exactly. Because it's not something they chose. They had hair, and now all of a sudden, especially if at a young age, it's even worse mentally. All of a sudden, you don't have this, and you think there is nothing you can do about it. Nowadays, obviously, it's easier, and just to mention, go back to what you said, that there is a wealth of information everywhere. I always call nowadays, like if someone doesn't know this or that, and they're losing hair, they don't know what's the medication, they're probably lazy. There's so much information out there. It's available on your fingertips. You just write down. And to be honest, nowadays, it's very difficult not to find finasteride, dutasteride, minoxidil, the proven treatments. 10 years ago, 15 years ago, 20 years ago, that was much more difficult. Nowadays, everyone starts calling each other out. If someone talks nonsense, they're going to be called out. So it's very difficult to find nonsense for the most part, let's say. Because it's simple. Like I said, there are very few medications on this planet that work, and it's been proven to work. There is no, behind a closed door or something. It's finasteride, minoxidil, dutasteride. That's it. It's simple as that. So if someone cannot find this, well, I'm sorry, you are not doing a great job. You don't really care as much. That's what I think. And again, going back to the mindset, that's basically what it is. They're hopeless because they feel like they cannot change it. But once you actually find a way to combat it and actually start reversing it, you all of a sudden feel empowered that, wow, I had something that was so devastating that I couldn't do anything about it, but now I found a way. It gives you this mental kind of boost that now every other thing is just nothing, compared to this. If you manage to overcome this, you're going to figure out other things in life. I think at least, that's how I feel about it. I'm pretty sure a lot of people think in the same way because, again, it stems from the fact that hair loss was something that we don't choose. And once we kind of find a way to fix it, then it becomes simple, I think.
There's a lot of successful men in the world, right? There's a lot of successful men. And something that I have noticed living in Los Angeles, I live here in Newport Beach now. It's a very wealthy, very affluent culture. Being that this is a men's health aspect is successful men do one thing in common. They all take action. They don't sit around. They don't limit themselves. They take action. And to correlate this with hair loss and hair loss medication and transplantation, the most successful guys I know, and I've treated like billionaires, when it came time for them to get a hair transplant, they were just like, all right, I'm going to set this up. I'm going to do this. I'm on medication. And they go. They do what they need to do. They take action. And that's the best advice that I would give anyone for hair loss is to take action. And if you don't take action, the results that you want are not going to come if you're not doing anything. What do you think about that? Do you think action is like probably the best thing? I'll leave it with you. I want you to close us out on what do you think is the most important thing someone can do today to mitigate the symptoms of hair loss?
I mean, you said yourself, taking action, and this translates in all kinds of things. Very simple. If you establish for yourself, well, first of all, you need to establish for yourself that you indeed do have hair loss because, you don't have to be in denial. But if you're going to be truthful with yourself, you're going to realize, hey, I do lose hair. Maybe I need to do something about it. Action. Start researching. Do proper research. Go speak to a doctor. Book a, appointment with the hair transplant doctor, with a dermatologist, trichologist. See what's up. Do your own, research. Online, there's plenty of, information like I mentioned earlier. Do something. Start researching, start learning. Once you're going to learn, then you're going to decide what's best for you, what is not best for you, and then do this. So then you're probably going to jump on some sort of medication to stop further progression of hair loss. And then you see, you happy with this or not? Okay, you stop your hair loss. Am I happy where I'm currently? Yes or no? If yes, I'm happy, that's it. Move on with life. Done. No, I'm not happy. Next step, going to be, there's a transplant, there's hair systems, there are hair fibers. Choose your poison. But
weapon of choice.
Weapon of choice, exactly. But I mean, it depends on, again, we're not going to go into the details. Obviously, there's a whole mindset why you should choose one or the other. All the options are available. None of them are wrong options. SMP as well. You can go for SMP. Nothing wrong with that. Plenty of results. People just covered basket. Amazing. Looks really natural if it's done properly. Again, that's it. Just choose what you need to do. Again, you need to understand what you need to do by researching, first of all. Educate yourself, find a way what you have to do, and just do it. Once you've done your transplants, your medication, you arrived at some point that, okay, now I'm comfortable with this. Now I find myself, the last 2-3 weeks, I didn't think about my hair at all. That's it. You win. You don't have to have a perfect hairline. You might have, Norwood 5, slightly, less density all around. But if you don't care about your hair, that's it. Move on. You don't have to chase perfection, essentially. That's it. You're a winner. You're done. Close the forums, close the YouTube channels. Contradicting, I know, when I'm a YouTuber, and we're talking about it. I always say to every single person, don't listen to me, don't listen to anyone, don't trust me, don't trust anyone. But also, once you arrive at your final goal, that's it. Close up. Close up all the browser tabs. That's it. Move on with the life, focus on other aspects of life. And that's it. Because to me, having a successful hair transplant is not about density, is not about the design. It's about your feeling, how you feel. If you had a transplant and you are able to move on, that's a success. And you should move on, close this podcast. Bye-bye.
Well, with that, I would say this. That's good. So, like you said, don't chase perfection. Go for your goals. And when you hit your goals, move forward. Mr. Rolandas, this has been awesome. Thanks for joining me today, man. This is really good. We will do this again. Maybe we'll have some more hot topics to talk about, more celebrities. But in the meantime, guys, please go follow Mr. Rolandas on YouTube, on Instagram. Anywhere else I'm missing? Those are your two main ones, right?
TikTok, Facebook, the standard things. All the links going to be usually in description of any of my videos. Pretty easy to find you.
Awesome. This podcast was produced by Pod Punch Studios. Stay tuned for more episodes of the Mane and Steel podcast. Be sure to like, subscribe, and leave a review wherever you're listening. Until then, keep moving forward.